Ideal workplace illumination is essential for both dentists and dental technicians, that which reproduces what we call sunlight. In practice, a well-lit workplace is one in which the dentist and dental technician's work is certainly made easier. This works in two ways. Firstly, for correct vision. Secondly, because incorrect lighting often induces fatigue. The eyes get tired, but also the mind, because we have particular allocations, also from a scientific point of view, that control our possibility of getting tired when faced by a dim light, a light that badly positions our operating area. It is therefore fundamental that the lights we use in our sector are those that give us the maximum guarantee. Every lamp must have a specific illumination because we have various types of color in the mouth. There tend to be two dominant colors, the white of the teeth and the red of the mucous membranes. We must have a lamp specificity that allows us to modulate the shades of color, therefore all the chromatic effects linked to the mucous membranes or the teeth. A white that mustn't be too brilliant. A mucous membrane, whether it be gingival, cheek, tongue or palate, that isn't too red. However, in these cases, above all with LED lamps, we can modulate this intensity, and this is a fundamental aspect. Nowadays, dental technicians need to document everything they do, and correct documentation lies behind a certain tranquility on the part of the dental technician when it comes to those jobs that are perhaps highly complex. The ideal solution is certainly to have a lamp that also contains a video camera. Why is this important? Because it allows us to do two things: have a well-lit operating area, and at the same time, when we position the lamp, we are hands-free to also make the most of the video camera. How? In the same way, we use our mobile phones. In other words, with the Wi-Fi, the possibility of modulating and controlling the video camera during filming via a remote system, and at the same time being sure the positioning is correct. This is because if the illumination of the operating area by a lamp that is clearly illuminated with LEDs is correct, our filming will also be correct. Another fundamental aspect is the fact that this type of solution avoids the annoying vibration during filming typical of a video camera not mounted on a fixed system. Naturally, in the systems we use for seating the patient in our chair, the lamp must be independent and not positioned on the chair itself. Therefore, if we have a system that allows this, a lamp with an incorporated video camera becomes the ideal solution.